All right. Good morning, everyone. How's everyone doing this morning? We good? That was pretty good. I know it's early on a Saturday morning. Maybe people were out late last night, but let's try one more time. How are we doing this morning? There we go. There we go. Here for science. I love it. And I'm so excited to be a part of this morning with you. I got to jump in last minute. I'll explain more about that in just a moment. But on behalf of the University of Calgary and the McKiN Institute for Bone and Joint Health, welcome to the Wood Forum 2025, Strength in Science, Exercise for Bone and Joint Health. So whether you're joining us in person, we also have quite a few people joining online, which is fantastic. Thank you so much for being here. Oh, there's my spotlight. I was waiting for it. Whew. I was worried I might not get my spotlight tracking me throughout the morning. Okay, so thank you so much for joining us. There are hundreds of people in the room. There are people tuning in online. So for the people online as well, let's give a round of applause for everyone showing up today. Some of you may be wondering, who is this person up here making us applaud 3 times already this early in the morning? I am Joelle Tomlinson, and I am so pleased to be your MC here today for this morning. You may have been expecting to see a Wood Forum MC that you've seen many times in the past, and that would be Lisa Bowes. And let me tell you, when I thought I was going to get to sit with Lisa Bowes at one point, I was so excited because growing up playing high-level hockey, I remember her calling the game play-by-play. I think it was 2010, and knowing she was a female doing this play-by-play commentary. She's one of my broadcasting heroes. But unfortunately, Lisa did have to take some time off for a surgery. So I get to slide in and fill some very, very big shoes. So I'm very appreciative to be here with you this morning. She does send her regrets, but let's all send our best wishes to Lisa as she recovers from a much-needed hip surgery. So happy to step in. I'm a broadcaster. I'm a journalist. Maybe at some point you were waking up with me at 5 in the morning. I was on CTV Morning Live for about 7 years here in Calgary. Originally from Saskatoon. Any Saskatchewanites in the house? Yeah, there's always like, we're everywhere, aren't we? You go through Mexico and you're like, Riders jersey, why are we everywhere? Being part of the Wood Forum is really special to me, and I'm so glad it worked out. Typically, my Saturday mornings are not free, so it felt very, very serendipitous. It combines a few things that I really care about. The science of sport, of course, and keeping our bodies healthy so we can keep doing what we love. Right now, I'm a washed-up athlete. We'll call it a washed-up athlete. I played a lot of sports growing up, and I am currently a long-distance runner. So I've experienced the thrill of training and also the frustration of injury. Quite a few injuries, in fact. I'm just back on my feet now. That journey has given me a massive appreciation for all of you being involved in this world and also the innovation behind bone and joint health. It's also a big part of my partner's life at home, which makes it part of my life. What's his is mine, obviously. He is a strength and conditioning coach and a kinesiologist, and just opened Calgary Strength and Physio. So a big part of the foundation of who I am. So grateful to be sharing the same space with people who are also dedicated for understanding how science moves us forward. To commence, I would like to take this opportunity to acknowledge the traditional territories of the people of Treaty 7 region in southern Alberta. Located in the heart of southern Alberta, we both acknowledge and pay tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda. The city of Calgary is also home to Métis Nation within Alberta, Nose Hill Métis District 5, and Albo Métis District 6. As someone who finds so much healing and a connection through movement outdoors, especially while running on these lands, I'm deeply grateful to learn from and move in the footsteps of the Indigenous peoples who have cared for them since time immemorial. We'll move on to some housekeeping notes, the best part of any forum, right? Just a few before we get going and start learning from the experts who have so generously showed up here today to start off our weekend together. Really glad that snow held off too. Right now I'm a weather forecaster at Global News, and I was watching the radar for all of you, so at least the roads were dry this morning. So for on-site attendees, bathrooms are located in several locations, very important, directly out the back doors to the right, straight ahead past Jugo Juice, We can blame them for needing the bathroom, right? And directly up the stairs or elevator on the 3rd floor. So a lot of options for us. We do get that sitting for long durations of time can be a little bit uncomfortable, need to stretch it out sometimes. So feel free to stand up, stretch those legs out at any point during presentations if you need. I knew when I saw that in the housekeeping notes that I was at a forum for bone and joint health. I was like, they care about our bodies. You will also have a scheduled opportunity to move. We have a movement for strength break. We've got Leah here. I told Leah I brought my sneakers, and she's like, don't worry, you didn't need to come that prepared. So we're in good hands. We're in good hands. In addition, we will also have a 20-minute break in the middle of the program. So at that point, you can get up, have some snacks. There was snacks out in the hall there. I see a little coffee corner there, and you can visit the partners in the resource area. To our virtual audience today, welcome, welcome. We're so happy to have you. Below the video screen, you are going to find the event program, and that's where you can submit those questions for the Q&A panel. Now, we always encourage questions. They will be addressed during a Q&A panel. We've dedicated time at the very end, so not in between presentations, if you're wondering where your questions went. For any technical issues for our virtual guests, reach out to Maven Media, through the technical support tab. For those attending in person, so all of you here in this beautiful hall, what a venue, it's incredible. We wanna make sure we answer your most burning questions, so we are using a simple audience interaction program. I just learned about it last week and I flipped through, very easy to use, I promise. I'm very technically challenged. I am an elder millennial, so I struggle with the simplest of things sometimes, but it's called Slido. Very easy to join, and you can submit your questions to Slido. You can use that QR code. There should be one on each of your tables. You just gotta scan that with your smartphone camera, or if you're like, I'm not into QR codes, you can go into your internet browser and just put slido.com, and then you enter the event code. If you need help with submitting those questions, don't worry, you're in good company. Please visit your volunteers at the Slido table outside during the break. On Slido, this is fun, you can also vote for next year's topic. You can pick as many of the suggested topics as you want, which is great. Lastly, today's presentations will be recorded. I was talking to Donna earlier, and it really excited me because it meant I could take this home and keep relearning from the material and also show it to my partner who's so interested in this world. Unfortunately, he had to be working within this world this morning. The recording will be shared on YouTube as well as the McKaigue Institute website just after the event. All right, some quick event background, and then we'll bring up our first opening remarks. Today's Wood Forum is an initiative sponsored through the Wood Joint Research Fund. You can see that beautiful photo on the screens behind me. This fund was generously established by Dr. John and Mrs. Christena Wood in 1998, and it's continued by their daughter. We just chatted, and I brought her up, Dr. Donna Wood, in their honor. So we are so happy to welcome family members here today. So among them, right in front, we have Dr. Donna Wood, her daughter Jennifer, who is lovely. Yes, give a wave if you want. I won't force you. As well as Miss Christena Wood's sister, Margaret Southern. So thank you so much for being here today. Round of applause for the family. I also know Dr. Donna Wood's husband is here too, so round of applause for, yeah. I see more family members than my notes say. Come and chat with them after, they are very friendly. This annual forum is designed to bring both the public and researchers together. So as I was talking with Donna, she was mentioning, or with her daughter actually, she was saying it's a good way to have this open, inclusive way of learning and bringing that knowledge to the public in almost a non-traditional way of learning. And that's bringing it together and making sure everyone has access. So it's an opportunity to explore the impacts of joint health, bone and joint diseases and injuries, and to stay informed about the current advancements in related research. And that research is so fascinating. I love learning about it. So we do extend our heartfelt gratitude to the entire Wood family for their unwavering support and leadership in making this event possible year after year. I'm doing it again for the entire Wood family. Thank you, thank you. Hands together, round of applause. So before we get into the program today, I would like to welcome up to the stage the Deputy Director of the McKaigue Institute for Bone and Joint Health. Dr. Roman Krawitz is a professor in the Cummings School of Medicine. He is a biomedical scientist whose research explores how adult stem cells contribute to the maintenance, repair, and regeneration of, I had to practice this one, musculoskeletal tissues. How'd I do?
Perfect.
Okay, good. I was in the mirror practicing that one this morning. His work focuses on understanding how inflammation influences the behavior and regenerative potential of these cells, particularly within joints affected by conditions such as osteoarthritis and rheumatoid arthritis. So a big warm welcome to Dr. Krawitz.
Thank you very much, Joelle. And as Joelle was saying, it's a pleasure to see over 400 people in the room and over 1,000 people online. So many people that are engaged in the health of their bone and joint tissue. So thank you all very much for joining us today. And as Joelle also said, the gracious support of the Wood family that we've been able to put this event on for over 3 decades now. So this is the 31st Annual Wood Forum. So thank you all for joining us today. Right. So, as Joelle said, I'm the Deputy Director of the McKaigue Institute for Bone and Joint Health. And for those of you that aren't familiar with the McKaigue Institute, there are some booths outside that have some information on the Institute and some of the labs that are present in the Institute. But the Institute is made up of labs from all faculties across the University of Calgary campus. So although it is centered in the Cummings School of Medicine, so we have a basic fundamental researchers like myself. We have engineers from engineering, kinesiologists from kinesiology. We have a couple people in nursing and arts. And then we have our clinical partners, so orthopedic surgeons, rheumatologists, endocrinologists studying osteoporotic diseases. And so the McKaigue Institute is a multidisciplinary institute made up of researchers, scientists, clinicians, all pushing in the same direction to try to develop new treatments and cures for our population suffering from bone and joint illness and disease. So to end this off, I just really want to say thank you. Thank you all for attending. Thank you all for being engaged in your bone and joint health. And it was my pleasure to welcome you here today. I hope that everybody has a wonderful time listening to our world-class speakers. And I will hand this back off to Joelle. Thank you.
Thank you. Thank you very much for those opening remarks, starting the day off right. And today we have an excellent lineup of, and he said it, world-class speakers here today. So we really are so fortunate. They will share their research on the topic of exercise and its important role in the health of our bones and our joints. So whether we're playing sports, spending time with family, enjoying hobbies, or simply going about our daily routines, strong and healthy bones and joints help us live life to the fullest. I shared a personal story with a few attendees here today and presenters, and my mom just had her knee replaced last week, and I just can't wait to see how her life expands when she can explore and travel and experience things with her granddaughter without feeling pain, chronic pain that she's felt for the last decade. So when our bones and joints aren't in great shape, like I just shared, it can really affect our ability to enjoy those things that we love. Fortunately, there are dedicated individuals who focus their careers and their lives on keeping us active and mobile, and I'm sure it's many of you here in this room and tuning in virtually. So today at the Wood Forum, we are lucky to hear from some of the experts in the field. So to kick us off today, I'm excited for this one. We welcome our first expert, Dr. Leigh Gabel. Now, Dr. Gabel is an assistant professor in the Faculty of Kinesiology at the University of Calgary. Her research explores how physical activity and exercise influence musculoskeletal health across the lifespan. Nailed it. Using advanced medical imaging, she aims to understand how movement can improve our bone and joint health. So please join me in welcoming Dr. Gabel as she shares her research, providing us with a better understanding of how to approach the menopausal transition. Hands together.
Thanks, Joelle. Okay. Good morning, everyone. I am thrilled to get us going today, and it's so nice to see so many of you here in the audience. I want to start by asking you to imagine yourself 10 or 20 years from now. How do you see yourself moving throughout your day? What does strength look and feel like for you at that age? Thank you. Now, let's travel back in time, not just decades, but generations. Women are born with all of the ovarian follicles or eggs that we will ever have. We have about 1 million of them at birth. By the time our first menstrual cycle arrives, we have only about half, or 500,000. And at menopause, less than 1,000 follicles remain. That means that the egg that was fertilized to become you was actually created while your mother was a growing fetus inside your grandmother. I'm going to let that sink in. Your story began inside 2 generations of women before you were even born. And if you're female, and if you've had a child, the egg that was fertilized to become your child was actually created while you were growing inside your mother. Your child's story began inside 2 generations of women before they were even born. And now 1 layer further. If you have a daughter, and that daughter has a child, and you're a grandmother, the egg that was fertilized to become your grandchild was actually created while your child was growing inside you. This beautifully illustrates that our bodies, including our bones, carry with them the stories, the strengths, and even the vulnerabilities of those who have come before us. That's biology, but it is also legacy. The menstrual cycle, it is far more than just a monthly event. It is the web of life. It is this dynamic hormonal dance that prepares the body to create and to sustain new life with the release of a mature follicle every month. It is the cycle that connects us across generations. And then there is menopause, marked by the end of the menstrual cycle, when we have no more follicles capable of maturing, and the closing of that life-sustaining cycle. But it is not the end of vitality. It is a shift into a new season of life. You may have heard menopause dismissed as a recent phenomenon, something that women only experience now because we are living longer. That maybe it's a bug in our evolution or didn't really serve a purpose. But I want to push back on those myths. Across human history, women have lived decades beyond their reproductive years. Even Aristotle, in the year 300 BC, noted that fertility ended around 40 to 50 years of age. But you see, life expectancy figures, like this one here, they can be misleading because they are averages that are dragged down during periods of high infant mortality. So when infant mortality was high, as in centuries and millennia before us, the average lifespan was low. But many women still lived long lives, well beyond their childbearing years. Menopause, it is not a mistake of evolution. It is a design feature. Most mammals do not live long past their reproductive years, not even our closest primate relatives, chimpanzees. But nature rarely makes mistakes. In fact, menopause may have been one of humanity's greatest adaptations. Evolutionary scientists propose the grandmother hypothesis, that menopause is not a biological failure, it is an adaptation. By no longer bearing children, older women could help keep the family alive, teaching, feeding, protecting. Menopause, it turns out, may have helped humanity survive. So, seen in this light, menopause is not a failure of biology, but a powerful stage. It's not the end of vitality, but a shift to a new purpose, and one that helped our species thrive. Now, menopause, while natural, brings profound physiological changes, and it's not just about your period stopping, and it is not all rosy. Women's health issues have been chronically and persistently underfunded, understudied, underserved, and undertaught. Nowhere is this more apparent than women's health during the menopause transition, and bone health is an example of this. Estrogen plays a critical role in maintaining the balance between bone breakdown and bone formation. During the menopause transition, estrogen levels decline rapidly and bone loss increases sharply. On this figure here, you're seeing the increase in bone mineral density, or BMD, during adolescence, peaking at about age 30, and then bone density declining into older adulthood. You'll see substantially different bone loss curves between men and women. Women can lose up to 10% of their bone mass during the menopause transition and the decade after. If I superimpose the average age of menopause on here, around age 51, it becomes abundantly clear that bone loss actually begins before the final menstrual cycle. It starts during perimenopause, when your cycles become irregular. But here is the hopeful part. While menopause is natural and menopause is inevitable for any woman who lives long enough, bone fragility is not inevitable, particularly if we understand it, prepare for it, and act. So this problem led our team to reimagine what could healthy aging look like. We wanted to know, can heavy strength training reduce or even prevent bone loss during the menopause transition? Over the past 2 years, our team has been conducting a randomized controlled trial in women during perimenopause and early postmenopause. Half of the women were randomized to the strength training group, where they came to see us here at the University of Calgary twice a week for 9 months for an hour each time, and worked in small groups with a certified trainer. The other half of the women were randomized to wait as a control group, waiting patiently, living their lives as per usual, and then we offered them the intervention at a later date. Here's a short video that gives you a bit of a sense of what went on during a typical training session. And I don't know if you caught the amount of weight being lifted on that barbell in the last deadlift. It was over 150 pounds. That is some serious strength. So I want to share with you some hot off the press results from this trial. I probably shouldn't even say hot off the press because we haven't published them yet, but hopefully will be soon. So I'm first going to show you results from the deadlift. So that's the movement that you saw. When thinking of a deadlift, you can think about bending down, picking up a couple heavy bags of groceries, and standing back up again. So after 3 months of the women learning correct movement patternings and building up first with lighter weights, they were actually able to lift about 90% of their body mass. So the line at 100 there, that represents lifting your entire body mass. So for a woman weighing 150 pounds, that's being able to lift 135 pounds. Now, that's not too bad, right? But after just 6 months of heavy strength training, the women were able to deadlift over 115% of their body mass, or 175 pounds. That was a 40-pound increase in just 6 months. Now that is strength that you can feel. Let's look now at the back squat. So thinking about the movement, it's akin to sitting down on a chair, getting back up again, but a pretty heavy weight on your back. In this photo, what you're seeing is actually our trainer, Leah, is behind the participant. Her hands are out and stretched as a spotter, and the participant is holding on to the bar. So after 3 months of learning how to lift correct movement patterns, women were able to lift a little bit more than 70% of their body mass. So that's about 120 pounds. Again, not bad, right? But after just 6 months of strength training, they were able to lift more than their body mass, or 150 pounds. That was a 34-pound increase over 6 months. Now that is strength that you can feel every time you're climbing stairs, every time you're swinging a golf club, every time you're lifting groceries or picking up a child. Now let's look inside the body. I'm going to first share with you changes that we saw in bone mineral density at the lumbar spine. And in these plots, you're going to see 2 lines. The first line in yellow represents women who were in the control group. So they weren't strength training with us, they were patiently waiting to be admitted into the program. And in these women, we actually saw a loss in bone mineral density at the lumbar spine over the 9 months. This is what we expect to see. But in the women who were strength training, they actually gained bone mineral density at the lumbar spine. During a life period where we are expecting to see loss, their bones got stronger. The story continues in muscle. In women who were in the control group, they lost lean body mass in the arms and the legs, while the women who were strength training with us gained lean body mass. Again, during a life period where we're expecting to see declines, their muscles grew. And in tests of power, so how high and how forcefully you can jump, again, declines in the women not strength training, and substantial gains in the women who were strength training. They improved substantially. And now, perhaps the most meaningful result. It's all about how you're feeling. So we asked women how they were feeling in terms of quality of life before and after the intervention, in terms of their general health. How do you feel compared to before? How is your health now? And how does it compare with others? Women in the control group experienced a decline in quality of life, typical to what we might expect to see during midlife, while the women who were strength training improved their quality of life dramatically. They reported greater confidence and better general health. Here is the powerful part. Bones respond to what we do. Muscles respond to what we do. Movement matters. You can't change your genetics. You cannot change the timing of menopause, but we can change how we move through it. Menopause. It is the end of the menstrual cycle. It is not the end of vitality. It is a biological shift into a new season of strength. And science is finally catching up to what women have always known. When we invest in women's health, everyone benefits. So let us honor our bodies, our cycles, our wisdom. Let us replace silence with strength, replacing myths with meaning. Now, please return to that vision from the beginning. Imagine yourself 10 or 20 years from today. How are you moving about your life? What does strength look like and feel like for you at that age? The investment that you make in your strength today It is not just for you. It is for the generations before and after you. And by investing in your strength today, I want you to consider, what kind of life could you be adding to your years? Because this is what midlife momentum looks like. Thank you.
Dr. Gabel, that was fantastic. I love how you brought it around with that vision. I was closing my eyes and imagining it, but I didn't even have to really create anything because I was out walking along the elbow not too long ago, and I saw a group of women. They were maybe in their 70s or so, and they were out jogging and laughing together, and I was like, oh, that's the dream. I hope that that's me in the next 30 years. So thank you so much for those insights and for talking to us about the importance of strength into those later ages. Okay, next up, we have Dr. Matt Jordan. We're so delighted to have him here. Dr. Jordan is an assistant professor in the Faculty of Kinesiology at the University of Calgary, where he co-leads the Integrative Neuromuscular Sport Performance Lab. His research focuses on neuromuscular adaptations to strength training, so it'll piggyback nicely on what you just heard about here, and strategies to prevent traumatic knee injuries. So please join me in welcoming Dr. Jordan as he shares his research and insights on the science behind maintaining healthy muscles at every age.
All right, it's just a real pleasure to be here this morning. Thanks, Leigh, for teeing this up. It's going to be a perfect segue, I hope. For the better part of my career, I've been about all things muscle strength and power, working with athletes, individuals after knee injury. But today I want to build on Leigh's talk and talk a little bit about what our muscle health does for our functionality. So again, I'm going to ask a question similar to Leigh, is to imagine what your independence looks like. What does your independence look like when you're in your 80s? What does your independence look like when you're going through the menopausal transition? Are you playing with your grandkids? Are you out back playing basketball? Are you able to stay in your house? Are you able to walk to the grocery store? These are all fundamental questions that I think lots of us have. Recently, you probably went to your doctor. They checked your blood pressure. They checked your cholesterol. But when was the last time you had your mechanical biomarkers checked? Now, mechanical biomarkers are intimately connected to our health and to healthy aging. And today I want to talk about muscle power. Muscle power, you probably think about it as something that's only for the athletes, but I hope today that I can make a good argument that it's actually even more important for our longevity. The important thing to say about muscle power is that this is about your strength and your speed. So when we put our strength and our speed together, like let's say doing a vertical jump, that's our muscle power. Now, you may be surprised to know that muscle power is increasingly on the radar in terms of our health and our longevity. And I'm not only talking about our mortality. In fact, our muscle power is connected to our mortality, but it's also intimately connected to living better years. In fact, when we look at studies that have evaluated the things that predict us living in our environments, staying in our houses, walking to the grocery store, playing with our kids, having that independence, muscle power is an independent predictor of our functional status. So muscle power is more than just for the athletes. Muscle power is something that actually predicts our independence across the lifespan. But here's the thing. Very similar to what's happening with bones in postmenopausal women, all humans begin losing their muscle power in their 40s, and we're losing muscle power 2 times faster than our strength. And this is what it means, is that by the time we get into our 80s, our 90s, we may not have sufficient muscle power to get up out of a chair, walk a flight of stairs, make it across the road as that hand starts flashing, right? And most alarmingly is that this is related to frailty and falls. And so a fall becomes this traumatic event. And after a fall, not only are we at risk for hospitalization and all the things that come after that, but it's something that leads to a loss of independence. And this is intimately connected to our muscle power. So we've got a new word to learn today. It's called powerpenia. Yeah, you may have heard of osteopenia, loss of bone density, sarcopenia, loss of muscle, but now in the science, we are talking more and more about this word called powerpenia, which is the loss of muscle power, and obviously something that we have to protect against. Now, here's the good news. The good news is exercise is our friend. So we've known for many, many decades that exercise is extremely productive in terms of our health. It might be the magic pill. Looking at this image on the screen, you can see it on your right-hand side. You'll notice that we've got 3 MRI images. These are scans of the thigh musculature. You'll notice the top scan is of a 40-year-old triathlete. You can see that nice full muscle. Below is a 70-year-old sedentary individual. You'll notice that there's been a loss of that muscle tissue. That dark, nice colored muscle has shrunk down. It's been infiltrated with fat. And then below it, we have a 70-year-old individual who's active. And you can see that muscle mass has been preserved. So we know that exercise is extremely beneficial. And I'm really excited here to tell you today that resistance training is really something that we should all be thinking about to maximize our health. I'll just take a second to remind you that it's not just about your muscles. Resistance training exerts many, many benefits. In addition to our bones, it's amazing for our brains. It's good for our metabolic health, our hearts, our mobility. Resistance training is truly an exercise that allows us to tap into the fountain of youth. So, you may be sitting in the audience saying to yourself, you know, I'm still not totally convinced that muscle power's for me. I think it's for the athletes. But as somebody who's spent their entire career working with athletes, I'm going to let you in on a little secret. The methods we use to test athlete power in our lab after injuries like knee injuries that affect an athlete's career, we actually stole them from aging studies, believe it or not. So the very same testing methodology that they were using to examine leg power in older adults in their 80s, is what we adopted in our lab to assess athletes. So leg power is certainly more than just for the athletes. This is something that the science has known for a long time. It's for all of us. Here's another really great secret to share with you all. Right across your lifespan, even into your 90s, you maintain the ability to increase your power output. You can increase this through heavy strength training, and we can also increase it through something called power training. This has been shown in numerous studies. It's been shown to exist for male and female individuals, and it really gives us a nice bright light of hope that no matter where you are, no matter what stage you're at, there's an opportunity for us to begin the journey of increasing our muscle health. So what are you going to do now? Well, if you've never engaged in strength training before or exercise, you need to find some help. You need to find some help. And so that might start by finding a personal trainer who can teach you the proper form, help you get familiarized with a weight room or maybe training at home. A personal trainer is the individual who can probably unlock a lot of potential on your journey to better muscle health. It's also super critical to remember that muscle strength, which is a little bit different than muscle power. Muscle strength is how strong you are. Power is strength and speed. But power is also intimately connected to our overall strength. And don't forget how important strength training is for tissues like our bone. The fun thing about power training is there's lots of different ways to increase it. So power training is a little bit different than heavy strength training because what we can use are lighter weights, maybe more like 40 to 60% of your max. And we can use movements like squats and lunges and deadlifts with these lighter weights where we move them quickly to increase our power output. So power training allows us to lift fast and maybe a little bit lighter, which can also be beneficial for many individuals. Now, if I haven't convinced you that power training is something that's accessible to everybody, and if maybe you're thinking to yourself, you know what, I'm not sure if I'm ready to go to a weight room, you could simply do a short sprint on a bike, and that's another way that you can increase your power output. A short 10-second sprint on a bike, where you do it a few times with a little bit of rest, is actually a really good method to increase your leg power. My final message. I want you to take this with you. This is important. It's never too late to start. It's never too late to start. Doesn't matter if you're sitting there in your 70s, pondering, questioning whether you have it within you. I want to tell you it's never too late to start. Now, this individual has been popping up in my slide deck. And you know who loves to brag about their family members? Parents. I'm a father of 3 boys, I'll tell you. I love talking about my kids. But how often do you get to brag about your mom? This is my mom. This is my mom. Yeah. Yeah. And let me tell you something. So she raised me and my sister. She spent her 30s and 40s on the treadmill of life, pursued a career as a computer programmer at Carleton University, went back to university. I can remember her being at the kitchen table when we were 9 and 10 years old studying. She got a job as a computer programmer before that was even a thing. She jokes now that when she was in her 50s, you know, the 4 o'clock snack in that space of computer programming was typically a Coke and a Snickers bar. That was the environment. And I don't think she ever could have imagined that one day she would be asking herself about what does independence look like. COVID got her. COVID was a time frame where she started to see her friends going to long-term care. She became fearful of what that could mean to her. And so she started the journey. She had type 2 diabetes, osteoporosis, high blood pressure. All the cards were stacked against her. And I'm really pleased to say that she met Jeff, her personal trainer, who turned it all around. Within 24 months, she was off the high blood pressure medication. She had essentially reversed the metabolic disease, reversed it. And she came to Calgary and she said, "Honey, look at my muscles. I've got my glutes back." It's unbelievable. Now, of course, my mom doesn't know that I'm doing this here today. She was pinging me. "Can I watch?" And I said, "Sure, yeah, you know, here's the link." So she'll probably will be watching. But Mom, I'm proud of you. I'm very proud of you. And so this was the text message this week as I was prepping. It went something like, you know, I made this appointment to go in to see Jeff so many times and I canceled it because I just didn't know if I had it in me to start this journey. But I felt puny and frail after COVID. I felt like I got lost in the chair when I sat down. And I'll tell you, this has unlocked her independence. So, Jeff, if you're watching, thank you. I am so very thankful that you've given my mom back her independence. So, with that, I encourage you all to embrace the opportunity for a new beginning, to harness the power of exercise, and to remember that strength is health. Thank you.
Thank you so much to Dr. Jordan. I heard the aw all the way through as it was, I'm proud of you, Mom, and I'm sure a lot of us feel the same way. So thank you for sharing that story. It reminds me of another woman at my husband's gym. It's his oldest client, and she's 102. Yeah, and she does not quite chin-ups, but assisted chin-ups. I'm not kidding. There's videos of it to prove. So it's just amazing to see what you can do with strength training. And you also reminded me of Wendy Alexis. Does anyone know who that name? World's fastest 70-year-old sprinter out of Ottawa. Yeah. She put down a 14.64 100-meter sprint. If you're in track, you can understand. If you're moving that fast, you're like a baby cheetah. So pretty incredible. And 70 years old. All right, thank you again so much. That was a very inspiring speech. Next up, we have our movement for mobility and break. You may have seen the celebrity earlier on in the performance here, and that is Leah. So it's my pleasure to introduce Leah Kaluta. She's a passionate physical activity researcher and exercise specialist. Leah has been in the industry for 25 years, helping people feel stronger and healthier and more confident through movement. So I'm sure that last story impacted you, Leah. The thank you to Jeff. She recently completed her Master in Science in Dr. Leigh Gabel's lab, where she studied high-intensity strength training for peri- and early postmenopausal women. Today, she's going to guide us through a movement for strength, and it's a session designed to be very accessible and very inclusive. No sprinting, I promise. I guess I shouldn't promise. Leah can promise you that. Following her session, we will take a short break. And we look forward to continuing the program right at 10:45. So please be ready to rejoin us then. And then after the break, we'll hear from our remaining presenters, get interactive with our speakers during the Q&A. So queue up those questions if they've been burning, and draw our door prizes as well. So make sure you've added your name to the draw to be considered for those prizes. You have to be present to win, okay? So make sure you come back and win those prizes. All right, let's bring up Leah with a warm round of applause. Let's move.
All right, everyone, we're going to get going. Thank you so much for the introduction. I'm really happy to be here and express my passion for movement. So, if you can, please stand up. We're going to move. We're going to start with some nice deep breaths. Breaths are the foundation of our movement. So let's take a nice deep breath in. Move your arms if you can, and exhale. And in, and out. One more, I promise. Okay, deep breath in. And out. Good. All right. We're going to just start walking on the spot for just about 30 seconds. So if you can, join me in just walking on the spot. If you choose to do this in your chair, keep walking. If you choose to do this in the chair, just little mini toe taps. Just keep walking on the spot. If this is really easy for you, let's add in some arm circles. You can even spice it up and do swinging your arms. If you hit your neighbor, I'm sorry. Just keep walking, move your arms however feels good for you. We're going to start increasing the intensity a little bit by bringing our knees up, nice and high. We're going to do a march. Now, with those arms, get them nice and high. Let's get the blood flow going, nice high knees. If you are sitting, if you prefer to do the sitting, just raise your knees nice and high. Apparently, I have lost a shoelace, so keep going. More wardrobe malfunction, just keep going. Move those arms nice and high. Come on, I want to see those arms right above your head if you can. Keep going. Nice. All right, we're almost there. Come on. If you want, you can go a little bit faster. Almost like she said no sprinting, so this is as fast as we're going to go, I promise. All right, and relax. So we had a lot of talk about strength and squats and deadlifts. So guess what we're gonna do? We're gonna squat. So the first thing we're gonna do is I'm gonna make it super easy. You're gonna stand up, sit down on your chair, stand back up, sit back down. If you prefer to do this seated, you can just have a seat in your chair and extend your knees out. We're gonna do this for 30 seconds. Are you ready? Okay, 3, 2, 1, stand up, sit down on your time. There you go. If you want to go with Dr. Jordan's message and get a little bit more power, explode out of that chair really fast, but go at your own pace. We're just working that leg power, that leg strength. We're almost there. Keep going. Are you feeling the burn yet? Some might be. Again, if you're just doing it in your chair, extending your legs, that's fine too. And relax. Okay. Yeah. Are you breathing heavy yet? A little bit? Okay, I might be out of shape. It's fine. Okay, so we're going to do some arm circles. So if you can, big arm circles. We're going to work on some shoulder strength here. If you're smacking your partner or someone beside you, go in front. Arm circles. We're going to do this for about 30 seconds. Keep going. Get those shoulders nice and moving. Let's do little mini circles. Let's go a little bit faster. Mini circles on the inside. Go the opposite direction. Mini circles on the outside. Big circles to the outside. Almost there. Shoulder health is really important. It helps us reach up and grab stuff on the top of the counter, so you don't have to use the counter as your step stool. Keep moving and relax. Okay. The last one of our strength portion is the deadlift. Don't worry, spooky season is over, but the deadlift is super important. So like Dr. Gabel said, it's just kind of like having groceries in your hands. So I want everyone to pretend that you have groceries. Put them down beside you, and we're gonna do some of these together. So just hinge down, think about picking something off the ground, and stand up. Pick something on the ground, put it down, stand up. Keep going, keep doing your deadlifts. If you are in your chair and want to do this seated, I just want you to bend forward and come on up. Bend forward, come on up. There you go. If you want to make this a little bit more explosive, go fast. Explode up. Again, the faster you go, we're going to get some more power. So like Dr. Jordan said, we can do this with light weight, but guess what? We can also do this with no weight and still work on our power. Nicely done, and relax. How you guys feeling? Woo! Okay, we're almost done. Another key component to longevity is, of course, balance. Balance also does take a lot of strength as well, but we're gonna start really easy. So if you need, hold onto a chair. We're gonna try a single leg balance. So if balance is a little challenging for you, you can have a tandem stance, so one foot in front of the other, or you can try picking up your leg. If you want to do this seated, stay in your chair and just pick up one foot. Are you ready? We're going to go 15 seconds. Are you ready? Yeah. Okay, thank you. All right, we're going to go in 3, 2, 1, and hold. Okay, if this is really easy for you, congratulations. This is a really big skill. You can start moving your arms side to side. Does that make it a little bit harder? Yeah, totally does. So do your hardest version. Stay on one leg. You can do your tandem stance, whatever works. Keep going. We're almost there. 4 more seconds. Nicely done. Good balance over here. And relax. Okay, shake it out. Other side. So again, you can do one foot in front of the other. You can sit in your chair or pick up a leg. Are you ready? 3, 2, 1. Let's pick it up and hold. If this is easy for you, move your arms. Forward and back, side to side. If this is really easy, try and look side to side. Move that head. Oh my goodness, I might actually fall off the stage. Okay, we're almost there. Keep going. Do your hardest version. Move your arms and legs. Move your head. Keep going. And relax. Nicely done. Congratulations. Woo! All right. We also need to have really good mobility as we age and have independence. So let's do some nice light stretching. So the first thing I want you to do is take one arm and go across your chest if you can, and just hold. You should feel a nice stretch back here And just breathe into it. Nice deep breaths in through your nose, out through your mouth. A few more seconds. And then let's switch sides. Across. Ooh, yeah, look. Everyone's doing this. Love this. Thank you. Deep breath in. Shoulder health is really important for independence. It allows us to open doors, pick up our laundry, have things overhead. So we want to keep our shoulders nice and healthy. Next up is we're going to try a chest stretch. So if you can, clasp your hands behind you, roll your shoulders back, open up that chest, and hold and breathe. A lot of our life is done seated, and that really kind of crunches up our body. So we want to open up that chest, get the air in. Like I said, breath is the foundation of our movement. We want to keep it nice and open. A few more seconds here. 3, 2, 1, and relax. Last stretch, I promise, and then we're done. We're going to do a hip flexor stretch on each side. So if you can, do this standing, one foot in front of the other, and think about driving your hips down and forward so you can feel a stretch here. If you prefer to do this seated, you're going to have a seat, cross your legs as much as you can, and stretch. All right, we're going to do a few seconds per side. So get into your lunge, drop the hips, squeeze your bum, move your pelvis forward until you can feel a stretch up through that hip flexor. Can you guys feel that? If you can't, squeeze that bum on that back. Drive that heel back to the back wall. Get a little bit lower. Feel that stretch through here. You really want to open up those hips. Just a few more seconds. And stand up, shake it out. Nicely done. Other side. Come on back. Drop those hips. Squeeze that bum. Drive the heel to the back wall. If that's really easy, get lower. Squeeze that bum. Drive the heel back. Hip flexors get really tight as we sit all day long, so we want to open those up. This is going to help with walking, with running, with what Dr. Jordan said with jumping. We really want these nice and loose. 3, 2, 1, and relax. Nicely done. A couple deep breaths to end it off, and then you guys can go have your coffee. Deep breath in, and out, and in, and out. And thank you so much. Enjoy the rest of the forum.
Okay, so we are going to move on, and we have the privilege of hearing from Dr. Laurie Hiemstra. Dr. Hiemstra is a clinical professor in the Faculty of Medicine at the University of Calgary, and no slouch here, also an orthopedic surgeon at Banff Sport Medicine. So she specializes in sport medicine knee ligament injuries. Her research centers on ACL reconstruction, patellofemoral instability, and enhancing surgical outcomes while preventing secondary injuries. So please join me in welcoming Dr. Hiemstra. She shares her research and tips for finding the sweet spot.
Morning, everyone. I'm really glad we had a little break there because following Leigh and Matt is a little bit of a challenge. So I'll even challenging enough, I'll get my slide mover. So I want everyone to imagine, we're imagining today, that you're lying in a hospital bed and you've just had knee surgery. You worked really hard to get to this point. You followed all the instructions, you did all the physio, and you finally navigated the disaster, that's our surgical wait list, and you've had your knee surgery. You remember how it all began. It was one fateful day at Lake Louise. The sky was bluebird. The day was glorious. But in the afternoon, it got a little bit icy, and you caught an edge. You heard a pop, you felt intense pain in your knee, followed by a really, really uncomfortable ride home down the mountain in that ski patrol sled. But you wake up in recovery room, feeling a little groggy, but hopeful. You're ready to get back out onto that ski hill, get back doing all those things you wanted to do. Everything's going to be all right again, but you never want to go through this again. Fast forward, it's 3 months later. There's great snow on the hill still, and you're raring to get back on that hill. You go and see your surgeon, and your hopes are crushed. They say at least 9 months until you can get back on the slopes. You waited a whole year to get your surgery. Why should you have to wait so long to get back doing the things you love to do. What kind of things are going through your head? This is my body. I get to make all the decisions. I worked harder than most people. I should be able to do the things I want to do. I'm different than everyone else. And my favorite, that surgeon doesn't know what they're talking about. Probably sounds familiar, right? I know, because there's a couple of my patients in the audience here. So, you do what most people do. You go back skiing, right? This time, though, you go to Sunshine. That'll be way safer, not as many tourists. It's another Bluebird day, and you go flying down that hill. You know you've made the right decision, but you catch an edge. You hear a pop, and you fall to a heap in the ground. With a sigh, and maybe a swear word, you pull the phone out of your pocket to call the ski patrol. Recovering from an injury or from surgery is a balancing act. Some patients think, push harder, get back faster, no pain, no gain. Other patients whisper, don't go too fast, take it nice and slow, I'm going to heal naturally. Both instincts make sense, and both come from a good place. But here's the truth, both extremes can sabotage your recovery. If you push too hard, you risk re-injuring yourself and having setbacks. If you don't push hard enough, you can be weak or stiff and not get back to the sports you like. Here's something most people don't realize. You can recover from many injuries and get back doing everything you want to do. But it's that next injury, the one that happens after your first injury, that changes the game. That's when the pathway back gets harder, when returning to sport starts to mean something different. Now, of course, preventing injuries in the first place is ideal. Wouldn't it be amazing if you never got hurt in the first place? But the truth is, if you never get injured, you're probably not doing very much, and you are definitely not having enough fun. The real key isn't just avoiding injury, but it's making sure that when you do get injured, and most of you probably will at some point, your first injury is your last injury. Think of it like finding the sweet spot. If you play tennis or golf or baseball, you know exactly what I'm talking about. And I'm not talking about that candy store on Banff Avenue. The sweet spot is that perfect point on your racket or your bat or your golf club or your pickleball paddle where everything just clicks. You don't even feel the ball connect, but yet it goes in the exact perfect spot. That's what recovery can be like. It's about finding that balance between too much and too little, between pushing and protecting. Let's go back to you. You ponder your situation as you ride down that sled at Sunshine. You sheepishly return to your surgeon. You've torn your ACL graft. And not only that, you've torn your meniscus and you've damaged your cartilage. You know what we call damaged cartilage, right? That's arthritis. So you have arthritis now, but you still want to fulfill your dreams of staying skiing, so you agree to a second surgery. You get your ACL reconstructed again, but the meniscus isn't repairable and they have to take it out. The post-op recovery isn't so easy this time. Your knee is stable, but it just doesn't feel like it used to. Fast forward 5 years. You got back to skiing, but your knee's really starting to act up over the last couple years. It's stable, but it really hurts you all the time, and you're having trouble getting out on the ski hill. You go to see your surgeon, and you ask them to scope your knee. That's where we stick a little camera in your knee and some instruments, and we clean things up. Your friend Ralph had one done, and they got completely better, but they didn't quite have the same problem that you have. Your surgeon says a scope will not help you, and they won't do the surgery. How can surgery not help? You were in so much pain. Obviously, surgery is going to help. Why won't that surgeon listen to you? Instead, they suggest some injections. That's an injection in your knee with like a really long needle. but you have to have them every 6 months for them to work really well. And they also want you to get a big, bulky brace. This one at least is covered by your insurance company. What is going on? All you wanted was a quick scope and to have your life return back to normal so you could do everything you wanted to do again. Get on the slopes this winter. A few more years go by. Your knee is getting worse and worse. It's starting to really hurt in the middle. And your leg's starting to bow, so you feel like you go in the Calgary Stampede. Now your surgeon wants to do something. But now they don't want to do just a simple little scope so you can get back really quick. They want to actually cut your bone, straighten out your leg, and then hold it in place with screws and a plate. That's called an osteotomy. You agree because you want to ski, and that makes your symptoms better for a few years. But then you go back to your surgeon because things are getting worse again. And now they say you need a knee replacement. But now you got a whole bunch of plate and screws in your knee. So you have to have another surgery to get the plate and screws out, right? So now you're in for it for injections every 6 months, lots of physio, lots of dollars, a big brace, 4 surgeries, and you're still facing a knee replacement, and you're still having trouble skiing. For many people, maybe even most, it's that second injury that's the real turning point. The moment when everything goes sideways. You've probably heard of the term, the tipping point. And it's that critical moment where a small change or a series of small changes suddenly pushes a system past its limit, triggering something big and often something irreversible. It's like that last snowflake that made the avalanche start, or the straw that broke the camel's back. So how do we avoid that from happening? How do we stop ourselves from sliding down that slippery slope? And that is the challenge. Sometimes bad things just happen. Sometimes surgeries don't work perfectly. But how do we minimize the chance for that second injury? You're waiting for this answer, right? It's actually really, really simple. Ready? Listen to your surgeon. So I know what you might be thinking. Of course I would say that. Of course I would. But hear me out. How do we know, as surgeons, how do we know when an injury really needs surgery? And how do we know which surgery to do? How do we decide how much rehabilitation you need? And how do we know when you're safe to go back to sport? How do we figure out how to prevent that second life-changing injury and make your first injury your last injury? Believe it or not, surgeons don't just flip a coin to see who gets surgery. We don't only operate on people we like, which is probably true, yeah. We're not just sitting around figuring out ways to keep you off the playing field or off the ski hill. Believe it or not, most surgeons would actually be very happy never to see any of you ever again, at least as our patient. But everything we recommend, every protocol, every timeline, every exercise is grounded in science. We call it clinical research. It's the kind of research that directly shapes how we treat injuries, how we guide recovery, and how we help you get back doing all the things you wanted to do, safely, confidently, and long-term. Now, I just want to change your perspective just a little bit. Let's imagine that you are me. Welcome to the mind of a surgeon. It's actually not that neat usually. It's a little messier. So when you first walked into my office, I didn't just see a patient. I saw a puzzle, something to figure out. So when you told me your story about how you got hurt and how your knee was feeling, I knew, based on evidence, that an ACL reconstruction would be the best operation to give you a stable knee, to return you to all the things you wanted to do, to prevent a second injury, and to protect your knee from getting arthritis as you got older. How did I know that? Well, let me tell you about some research studies we're doing. This is the stability study. This is a multi-center, so lots of centers, international, lots of countries, trial, and it included both the University of Calgary and Banff Sport Medicine. This study taught us that in high-risk patients, if we add a little step to our ACL reconstruction called an LET, which is a lateral extra-articular tenodesis, you can see why we use acronyms a lot, right? So if we add that step to your surgery, it actually reduces the chance of you tearing your graft. So as we take a little piece of the outside muscle of your knee and we reroute it and reattach it, it's a little like if your ACL was a belt and we added some suspenders. So we know from this study, if you're high risk and we add that little extra procedure, we reduce the risk of your graft rupturing by 60%. And we also know that if you delay returning to your sport, every month that you delay that, it reduces the chance of that graft rupturing by 14%. If you're not high risk, if you're normal, moderate or low risk, the LET doesn't change your outcome at all. So why would you add any extra surgery? So when you came into my office, I knew that you were a perfect candidate for an ACL reconstruction. The best graft for you would be a hamstring tendon, and you didn't need to add the extra LET. There's more. In BAM Sport Medicine, we're doing a delay OA study, and you can imagine what that one's about. But we're investigating how, when you have your ACL reconstruction, if your cartilage is perfect and your meniscus isn't torn, the chance of you developing arthritis down the road is very, very low. So when I came into your room after you had your surgery, and I said, you know what, the surgery went great. You had no cartilage damage, your meniscus was fine, you're going to do really, really well. I was actually speaking from decades of research. I wasn't just trying to make you feel good. Research also lets me tell you the risks of having surgery or the risks and benefits of not having surgery and treating your knee with rehabilitation. Because of studies that I've done here at U of C, I could tell you that it was safe for me to send you home the same day as surgery. You didn't need to stay in the hospital overnight. And this is what evidence-based surgery looks like. We're not just guessing. It's the culmination of years of science carefully applied to you. After your surgery was over, the journey isn't done. Research from Winnipeg has shown us exactly when it's safe to start more aggressive strength training, like plyos and box jumps. Other clinical studies help shape the rehabilitation programs that you and your physiotherapist followed perfectly, right? So that you can safely return your strength and get back to your sport. And what about returning to sport? Research tells us that the biggest barrier is actually not your knee, it's your mind. Fear of re-injury is a key factor in whether patients get back doing the sports they love. So in my case, I have a whole bunch of patients that need a whole bunch more fear, and I have a whole bunch of patients that could get rid of a whole bunch of fear. The truth is some patients have a lot of difficulty returning back to the sport where they first injured their knee. And it's my job as their surgeon to give them some tough love sometimes to steer them back towards that sweet spot in their recovery. Later, when you came to my office, when your knee started wearing out and things seemed to be going downhill, decades of Canadian research have given us clear answers. This study in the New England Journal of Medicine, which is medicine's top journal, this study was done in London, Ontario. We actually did this study when I was training as a fellow, which was a couple of years ago. But that study showed us that scoping a knee for arthritis rarely works, which is why your surgeon wouldn't offer you a scope. But this study became world famous and has directed many of the guidelines around the world, including our Canadian guidelines, which tell us when it is a good idea to scope the knee, and arthritis isn't the top of that list. We know that procedure to straighten your knee, that one you had, the osteotomy, we know that delays a knee replacement by an average of 9.5 years. That was research also done in London by Canadians. And we know exactly when we've reached the limit of what we can do for you, and that a knee replacement really is the only option, whether or not that's what you wanted to hear. Science guides every step, from your first injury to when we make the decision to you need a knee replacement. And while every patient's journey is unique, research gives us a roadmap, a way to make the path clear towards us clearer, safer, and smarter. So we're going to fast forward to the present. Since you're now recovering from your knee replacement, you have time to come to the Wood Forum and listen to us all talk. And you do understand the importance of finding the sweet spot in your recovery. And you know that clinical research informs everything we do for patient care and what your surgeons are telling you. So we can tell our opening story with a little better ending. We can get in our DeLorean time machine back to that first 3-month visit you had with your surgeon. This time, you listen to your surgeon, who clearly has your best interests at heart. You get back into the gym and you maximize your rehab. You take the year off skiing so that you can return to skiing with full strength, coordination, and confidence. The next year, you ski like you were made for it, and you do so for the next 25 years with no further injuries and no further surgeries. Congratulations, you have successfully made your first injury your last injury. Thank you.
Thank you so much to Dr. Hiemstra. I've recently been in and out of some surgeons' offices, and I can see why when I brought my ChatGPT explanation to them, they were not having it. We should trust science, and thank you for absolutely underlining that importance for us. That was a fantastic presentation. Finally, we have the honor of hearing from our last expert today. That's Dr. Laurie Beaupre. So Dr. Beaupre is the physical therapist and a professor in the Department of Physical Therapy at the University of Alberta. Her research focuses on outcomes and health services for people living with arthritis or recovering from joint replacement. I love the order that these speakers are in. Everyone kind of builds on one another. So please join me in welcoming Dr. Beaupre as she uses science to help us understand why and how to move our bodies, even when we have sore joints. Thank you.
Wow, it is so great to see so many people in the room and to know how many are online and wanting to know how to stay healthy and active as they age. But as a physiotherapist, I wonder how many of you are sitting here thinking, I want to be more active, but my hip, my knee, my back, insert sore joint here, hurts when I try to move and exercise, and I worry about whether or not I'm harming my joint if I'm active. As some of us, as we age, are going to develop joint pain related to osteoarthritis, which is also known as OA, arthritis, degenerative arthritis, wear and tear arthritis. It has a lot of different names. And if you've been diagnosed with osteoarthritis, know you're not alone. Greater than 4 million Canadians, oops, what are we doing here? Greater than 4 million Canadians live with osteoarthritis every day. And the symptom that they talk about the most when they live with osteoarthritis is pain. I want to start with a story from a 7-year-old woman who was struggling to be active while living with knee osteoarthritis. She said, I'd stopped going to my Tai Chi class and stopped walking. I didn't quite know how to turn around because every time I turned around, I would injure a leg. Does that resonate with some of you here? Is that thought about should I move or not when I have a sore joint? Exercise is a really good thing for us to do because when we exercise, we strengthen our muscles, and strong muscles support sore joints better than weak muscles do. And I know some of you are probably thinking, so the crazy physio up here is telling me that what I need to do to make my sore joints feel better is to move and exercise. And what I would say to her is moving and exercise is what makes me sore. But here's what happened to our 7-year-old woman who completed an 8-week osteoarthritis exercise and education program. She said, the program stopped my cycle of injury and started building me. I could do three of one exercise, then 5, then 7, and then up to 10. I know the exercises are helping me, so I'm going to keep doing them. I'm almost brave enough to go back to Tai Chi. So as a physio, I know that exercise really does help because, again, strong muscles support sore joints better than weak muscles can. But I also understand people's concern about, well, how much does it have to hurt? And are you sure that that pain isn't making my joint get worse and my arthritis get worse? So before we talk about exercise, we're going to talk about pain. Because pain is complex, and there's a lot of what seems to be conflicting information about what you should do. You should move. No, wait until it feels better and then move. No pain, no gain. And this can be really confusing to patients. But some of this confusion is because there's different kinds of pain, and we manage different kinds of pain in different ways. So acute pain is the pain you experience when you fall, you sprain an ankle, you maybe break a bone, you undergo surgery. And when you have acute pain, we'll apply the RICE principle of rest, ice, compression, and elevation. And here we are saying, okay, don't exercise too much, don't push through your pain, go slow, take it easy. But here's the thing with acute pain. We expect it to be short-lived and resolve, and to go away as you start to recover from your injury or surgery. Chronic pain, on the other hand, like osteoarthritis pain, is pain that does not go away, and it can even start without an injury. Often people will talk about a joint that's achy if they stand on it too much, that gradually progresses to a joint that hurts every time you try and go up and down the stairs. Because this is pain that doesn't go away easily, we have to start to treat and manage it differently. And know that chronic pain, unfortunately, is more common than acute pain, and it becomes more common in older people. So 4 in 10 people in their 70s are living with osteoarthritis. And for some of you, if you've had a knee injury, you may actually have the onset of osteoarthritis in your 30s and 40s. So we have to think about how do we manage chronic pain, because you can't wait for the pain to get better. So this is a statement that I think many people think is true. Exercising when you have osteoarthritis and joint pain is harmful to you and your sore joint. And if there's one thing I want you to take away today, it's like, this is not true. Exercise is actually your friend, because if we can build the strength in your muscles, they're going to support your sore joints better. And we have pretty good evidence, actually, that exercise works to manage osteoarthritis. So this is one of the few research slides I'm going to show you today. But this is a really large study of almost 30,000 people from 3 different countries. So the results in blue are from Denmark, in red from Canada, and in green from Australia. And they looked at the change, the improvement in pain, the ability to rise and sit down in a chair rapidly, as well as people's overall quality of life after they completed a 6-week osteoarthritis exercise and education program. And so what they saw is, they measured the change in the outcomes using something that's called an effect size. And what you need to know about an effect size is, if you see an effect size greater than 0.3, we know as clinicians that we can measure that difference and that patients will tell us that things have changed for them. So you can see across all 3 of the outcomes in all 3 of the countries, in almost 30,000 people, we had effect sizes that improved all of these outcomes much greater than 0.3 in most cases. So this is pretty solid evidence that exercise is effective to help manage your osteoarthritis. But let me go back to a story, because I think sometimes stories are easier to relate to. So this was a woman in her 70s who was considering her need for a knee replacement surgery. And she said, before I started the program, I was taking Tylenol regularly, and I'd stopped doing some of the things that I enjoyed and the activities I enjoyed. Again, really struggling to be active and live with osteoarthritis. After she finished the program, she said it was great to learn about how to manage my arthritis, as well as the exercises to do and how to progress them. I'm now much more active and back to gardening, doing the things that I enjoy. So exercise is your tool to get to you, be able to do the things that you want to be able to do. And I know that, and she was no longer considering her need for a joint replacement. It is not inevitable, if you get osteoarthritis, that you are going to need a joint replacement. Exercise can work. And I know, crazy physio again, you don't understand how much pain I have. Exercise is not going to work for me. But most people start the program thinking that, and are often surprised at how they can learn and be able to actually improve with exercise despite having pain. We recently did a study with 100 rural Albertans who were living with hip or knee osteoarthritis and are, again, considering their need for joint replacement. And what we found is, after the 8-week program, 91 of 100 reported improvement in at least pain, function, and/or quality of life after completing the program. Exercise is good medicine for osteoarthritis. And when we checked in with them, 1 year later, most had retained the program benefits. And so they told us it's not just about learning about exercise, it's also learning about osteoarthritis and how to manage that pain associated with osteoarthritis. Knowledge is power here when you're living with osteoarthritis, to understand what the disease is and how to best manage it. I want to challenge you here, if you live with osteoarthritis, to change how you think about your pain. And instead of thinking about how much does it hurt and how much worse is it going to get, I want you instead to think about how much does the pain interfere with what I want to do. When we start to think about pain as interfering, we can also then start to think about, well, what could I do to make it interfere a bit less? And when we start to do that, that's a first step to starting to be able to actively manage your pain associated with osteoarthritis. I want you to imagine your pain. We do like the word imagine this morning. I want you to imagine your pain interference as a traffic light. If you're sitting here right now and you've got an achy joint, so a pain score of 1 to 2 on a scale of 0 to 10, where 0 is no pain, lovely, and 10 is the worst pain that you can imagine, what does your achy joint do when you try to exercise or be active on it? If it doesn't change, then be active, because you're going to get the benefits of the activity, both the muscle strength, your bone health, and maybe even your pain will improve. And you're not going to harm your joint. So you might as well exercise. Pain between 0 and 2 is a green light to be able to continue your exercise and activity so that you can maintain your muscle strength. More commonly, people will tell us that their pain increases as they try to be more active, and that's still okay. If your pain is greater than 2, but no greater than 5, you're still in a safe and acceptable exercise zone with your osteoarthritis. So you can continue with this one, but you're going to monitor a little bit now, because if your pain goes to greater than 5, into 6 or more, you're now into what we call the red light zone, and you should stop or back off to get back down into that safe zone. And the reason we want you to stop there is less about the harm to the joint and more about what it will do to how long your pain lasts. If your pain, your increased pain after you exercise, goes back to your usual resting level within a day of stopping the exercise, you're exercising at the right level, and that's where you should be working. If your pain stays elevated for more than a day after you stop exercise, you're probably working too hard and you need to bring it down. You should not stop, but you should back off. And you can back off by doing simple things like do fewer exercises or do fewer repetitions of each exercise. You can give yourself rest days between activity days. You can shorten your sessions and do 2 shorter sessions or just not exercise quite as heavily. You don't have to use weights when you're first starting. You can just use your body weight until you build more strength, because your goal is to stay in the yellow light zone so you can stay active. If you're someone who doesn't really like the idea of going to the gym and getting all sweaty, that's okay. You can still strengthen your muscles even working at home. And one of the best exercises that we can do as we get older is something that's called the sit-to-stand exercise, because we all have to get in and out of a chair multiple times. If it's hard for you to get out of a chair right now because your joints are sore, then you can start with a chair with arms. And the goal of this exercise is that you would aim to be able to do 2 to 3 sets of 10 to 15 repetitions using your arms to help you stand up, and this is going to help strengthen the muscles in your legs and in your back and in your core. Once you get to that point, then you can progress to using no arms, and your aim is the same thing. You want to be able to rise from sitting 2 to 3 sets of 10 to 15, and when you can do that, then you can add weights. And you don't even have to go out and buy weights. You can just go to your pantry, because you can grab soup cans, jugs, and fill them with water, and that's a way to build weight. This exercise is one of the most important exercises that you can do as you age, because if you want to remain in your home and live independently, you have to be able to get up and down from a chair, in and out of bed, on and off the toilet without falling. So if you only ever wanted to do one exercise to help hip or knee osteoarthritis, this is a fantastic exercise to do. If you're instead, though, somebody who actually is active and really struggling to stay active because of your pain, know that your mental attitude is going to be key to your success. You want to avoid that all or none mentality. You know that, I'm going to shovel all the walks, I am going to get my laundry done today, I'm going to finish this workout even if it kills me. When you take that approach to exercise, you're probably in the red light zone. And so what that does is it means you're going to be sore for more than a day. And that can be really discouraging. So back it off a bit, take it back into the yellow zone, and you have to go slower. You maybe have to spread your activities over more time, which can be really frustrating. But the goal here is that you can consistently be active, you can consistently build your strength, so you can progress in terms of what you're doing, and you don't have to experience as much pain. This simple, not easy, simple change in attitude can be really empowering. What are other things that you could do that can make managing your pain a little bit easier? Heat and ice are effective to help osteoarthritis, although ice is usually more effective if you have increased pain after exercise. You can use, walking sticks, canes, walkers to help you mobilize off, because they offload the joint and they'll actually help your balance. For the woman on the left, though, I'll tell you that walking sticks are meant to be on the ground. Don't carry them. This is what my 88-year-old mother likes to do, and I'm like, no, use them. You're supposed to use them. So these can help offload the joints, and use them if they'll help you be more active. You also don't need to buy expensive knee braces or think about really expensive shoe insoles, but if they help you, if a simple knee brace or putting an insole in your shoe will allow you to be more active, then use them. Because your goal is you need to exercise. Those things can't replace exercise. You have to build your muscle strength because strong muscles support sore joints better than weak muscles do. So if you are living with osteoarthritis, I want you to think about what could your life look like in a year or 2 years or even 5 years down the road if you started to actively manage and control your osteoarthritis. Here's a prescription that can help you achieve the things that you want to be able to do. Use the pain traffic light. It's because pain is fluid. So on your good days, do more, and on your sore days, do less. But don't stop. Your goal is to sit less and do more. You have to move and exercise to keep your muscles strong. And you got to be patient because exercise isn't a quick fix. You're going to have to exercise for at least 2 to 6 weeks to start to see the benefits. But once you achieve some benefits, you can actually maintain those benefits for, doing exercise 1 to 3 times a week because you got to keep doing them. So if you don't use them, you lose them. So you got to build this into your lifestyle to manage your osteoarthritis. But what have you got to lose compared to what you might gain if you decide to take control and manage your osteoarthritis? Exercise is good medicine. Thank you. I think we're coming up, right?
Made me exercise to get up here. Nice. Okay. Thank you so much, Dr. Beaupre. You can hang out with me because we've got an exciting Q&A. I know the questions have been coming in hard and fast, which is fantastic. So I'd like to ask all our presenters, they knew their cue, to come return to the stage for a panel discussion. And I'd like to encourage you, the audience, to take part in this by using the Slido app. We talked about it at the start of the forum today. The instructions right there on your screens, on your tables as well. The way this works is we have moderators out there, and what they're doing is sorting and watching all the Slido questions that come in, both from our virtual and from our in-person audience here. Please remember, our experts are happy to answer questions, but will not offer specific medical advice, okay? And Dr. Jordan did have to leave, but now his flight was delayed a little bit, so I'm sorry for the flight being delayed, but we're happy to have you for longer, selfishly. So we will begin that Q&A. I just have to pull out my iPad here and answer some questions. One moment. Technology refreshing on me. All right, we're going to start off with a question here from Bridget. And this one's not directed to anyone in particular, so whoever wants to jump in is more than welcome if you want to start off. And it's, is there a danger of exercising too much in an aging body?
Sounds like Matt.
I think, when we think about that, think about how much pain do you experience and how much pain do you live with on a regular basis. If you don't have pain, be as active as you can. I think we have a tendency as we get older to start thinking that back off. If things get harder, we think we should stop doing that. No, don't stop doing that because other things will start to become harder. So I would encourage lots of exercise. I don't think we like to put limits on exercise.
But I think we're not really worried about folks whose problem is that they might be exercising too much. I think we're more concerned about the folks who haven't even started or aren't on that journey yet.
Yep. I would just say don't get injured. So exercise all you want, don't get injured.
And maybe just to round out the question with one small thought. Exercise, like, let's face it, it's poison and medicine, right? It's a great medicine, but it's not just older individuals where exercise can be problematic. It can also be problematic for kids who over-exercise and train too much, or athletes. So I do think, from the balance of it, I totally agree that exercising is better than not, 100%. But it should be sort of a friendly approach that you take to figure out where you are, and allow it to be progressive. I think that's a thought that maybe I can add to round out the question. Yeah.
All right, fantastic. Okay, this one is I'm going to pick one specifically for Dr. Gabel. What was the total bone density increase in the weight training experimental group from their base starting point?
Okay, great question. Yeah, it was about just over a 1% gain compared to a 1% loss over time. And again, we were going to be happy with maintaining bone mineral density, right? Any prevention of bone loss is good. So in the figure I showed, it was about a 1% increase.
This one's fun. I want to know who's going to jump in for this one. Do vibration machines help build muscle mass and thus bone density? Anyone have a thought on those? I've seen them. I'm getting targeted on Instagram for them, so I'm curious.
And I'll just hop in quickly.
Yeah.
Little side story here, but I did my master's research in whole body vibration training. And I think we might have had one of the first vibration platforms in North America, probably in the early O's, and we were using it with athletes, and we studied it very, very carefully because we wanted to see what it could do for strength and power. And in that population, not much happened, but there is some research looking at vibration for bone. I don't know if Leigh's got any further comments on that. Not my main area, but...
Yeah, I have to say I haven't seen any good evidence supporting its effectiveness for improving bone. The caveat would be if you're not doing anything, doing something is probably going to be beneficial, but it's not giving us the same stimulus that we'd get from bearing weight on bones through strength training or moving.
Anything to add over here? No?
No, I'd agree. I think, vibration, what it might do as you get older is maybe help balance a little bit when you're doing that, but actively doing things is more benefit. I know we'd always like the easy fix, right? Is there something I could just sit on and that will strengthen my muscles? And the answer is, yeah, your chair, but you have to stand up and sit down for it to be a benefit to you. So,
sit less, do more, right? I love that. This one's a great one. Where can seniors find a personal trainer that understands an aging body in the community?
Yeah, I think there are many excellent personal trainers throughout the community. It may take a bit of searching to find what's best for you. If you're dealing with low bone mass or osteoporosis, there is a program called Bone Fit, and you can find a Bone Fit certified personal trainer, and there's several of them throughout Calgary. So that would be a good first step if you're looking for somebody who knows how to prescribe movements in folks who are having issues with bone mass.
I'm going to piggyback on that one. A lot of these are about working out, and I think that's fantastic. As someone with osteoporosis in my spine, How quickly can I safely increase weight in squats and deadlifts since it seems muscle responds faster than bone?
Yeah. I'll start, and maybe Matt wants to take over. Everybody's going to be unique, so I can't give a prescription here. I can tell you what we did in our program. We didn't exclude anyone with osteoporosis, but we had a few folks with low bone mass, but nobody with osteoporosis. But we did 3 months of movement patterning. Leah ran basically a month of teaching folks how to breathe properly and engaging those muscles correctly. And then we added in 2 months of light lifting. So there was 3 months before we ever put a barbell or anything heavier into somebody's hands. So I think probably what's key to understand is with any program, it's going to be progressive, but it always starts light, and it starts where you're at that point in time, and where you can build from safely. And that's going to be through having somebody help you out, learning those movement patterns, correcting your form, so that when you do start to add weight, and if you do want to get stronger over time, it needs to be progressive, and it needs to be done with effort. So something that makes you feel tired and fatigued, but always with good form. So I would say, I'd echo Lauren's comments that it's not a fast journey. It's going to be a slow go.
Maybe I'll just add one more idea around this that the literature has been pointing to much, much more these days. You think back to what your mind's image is of somebody who's lifting weights and they're grinding underneath a bar and going to what we call momentary failure. And momentary failure would be that point where you can't lift it by yourself anymore, and maybe you need a spotter to finish the movement. I'll just echo that there's more and more research showing that if you stay away from momentary failure, so we call it keeping repetitions in reserve, which means you stop just below where you hit your max. It's actually quite effective as well. So maybe the take-home message is, you're going to learn movement technique. Strength is a skill. You're going to get a good trainer who understands how to lift properly so you don't hurt yourself. That's really, really key to understand. And I think maybe catching up to today's science is you can maybe forget about the days where you were grinding to that very end point with the max weight you could lift. And as Leigh says, it's going to be hard, but it doesn't have to be past that point for it to be effective.
Can I add one thing? Because I'm hoping it'll come up. It probably doesn't have to be really, really heavy.
Yeah.
So the trial we were running, we wanted women lifting heavy because we wanted to see what would happen with this really big stimulus. But you can get to that point where you only have 1 or 2 reps in reserve with light weights. You just have to lift them for more. Yep. So you can start with what you have, and I know that the idea of lifting heavy can be pretty daunting, so it doesn't have to be, totally. But you can get to that point where you feel tired and fatigued in a lower or medium range as well.
Dr. Beaupre or Dr. Hiemstra, any thoughts on that question before I move on?
No, I mean, I think they've covered it. And if you have joint pain in there, you're going to factor in those things as well. But you can still get progressive resistance training by using lighter weights and doing more of them versus thinking I'm going to lift really heavy weights. And again, you're going to try and think about where does it put my pain? If it takes me up over into the higher levels, I'm going to back it off and use lighter weights. So it really is an individual journey in terms of where you're starting and what can you do. But I agree with Matt, you don't have to think, I have to get so I can lift, for Leigh, I mean, it was fantastic they could lift so much more weight at the end of it. But you don't have to do that to show benefit. Anything that you do that you're doing more than you're doing today is a step forward in your journey to better health.
Yeah, I always tell my patients, if you're going to run a marathon and you've never run before, you don't go run 20 miles your first day, right? You probably do a little walk run for 10 minutes and be gasping for breath. But if you keep on those programs and increase slowly, eventually you can run a marathon. So it's the same thing with lifting. Start slow and start light, and don't build up too fast.
We'll stay with you, Dr. Hiemstra. Can you please speak to glucosamine and, I hope I say this right, chondroitin?
Chondroitin.
All right, supplements, both for maintaining healthy joints and bones and for injury rehab.
Yeah, sure. You can. There's going to be a theme here. If you have arthritis pain, there's not one thing, except maybe a replacement, that will help that. There's going to be a lot of things. So losing weight is probably the biggest thing you can do. Getting strong is the next biggest thing you can do. So there's a whole bunch of things that you can use to treat arthritis. And then you can start adding some Advil or some Tylenol, and then you might add injections. And so there's a whole round of things you can use to treat arthritis pain. And if each one of those things helps 5%, you're actually going to get some relief. But we know from listening today what the most important things are, right? So things like, we call them nutraceuticals, so they're like vitamins, and they provide some sort of factors like glucosamine and chondroitin. They're not going to hurt you. So if you're not taking them and you start taking them and it helps you, by all means, take them. But there's no guarantee they are going to help you. And usually things that promise like really great results is usually somebody trying to fool you. So again, try all these things. If they really help you, if you have a magnetic bracelet that you think makes you feel better, it's probably in your head. But if it makes you feel better, wear the magnetic bracelet because it's not hurting you. So that's why I fit nutraceuticals. By all means, try them, and if you feel they help. But the evidence is minimal.
As I tuck my weighted bracelet at my back, I'm like... For Dr. Gabel, how is the use or non-use of hormone replacement therapy in study participants taken into account? If so, did HRT use provide more beneficial results?
Yeah, that's a really great question and pretty timely. So we included women who were taking menopause hormone therapy in the trial. We didn't have very many women on menopause hormone therapy, and so we actually couldn't look to see whether or not there was any added benefit. We know from previous research conducted that, and we also know estrogen is good for bone, but it can help protect bone health. This was sort of the first study that we've done in this work, and we're hoping to conduct a larger trial in future where one of the questions would actually be, do women on MHT receive greater benefit?
Okay, interesting stuff. I'm going to go to you, Dr. Jordan, on this one, and then anyone else can chime in as well. Is HIIT, always popular, polarizing online, but is HIIT a good way to train in combination with strength to gain muscle power?
Yeah, so I think the key thing is that HIIT, I think has sort of maybe think about it like an umbrella term. And so there are ways that you can design an interval program to work on your power. But the important thing to say about power is not getting to that end range of the interval where you feel like you're going to puke. Power is really about the expression of strength with speed. So it's more about going really, really hard for a very short period of time and then giving your body a rest. So it's a little bit different, but you could do that on a bike. So those are some things that I think are maybe a good idea around muscle power training. So think about the intervals as maybe one slice of how we could do power training, but your classic sitting on a bike and going until you're going to get that feeling like you're going to puke and working super hard with the sweat and all that. That's not so much a power training modality. Yeah.
And was very popular at one time to go until puking kind of thing.
100%. Yeah, I think there's, you might say that in terms of I'll talk a little bit about sort of cardiovascular health, but there's a lot of evidence for that low intensity exercise, that aerobic exercise. That's actually coming back, which is nice. The pendulum had swung. This goes to show you about research and science and Instagram, right? The pendulum had swung so far to the one side that all the conversations were that the aerobic exercise was going to be it'll ruin the gains, you got to stay away from it. But that's really shifted back. We're much more aware now of how important that low intensity aerobic work is. And certainly interval training is another way that you can really boost cardiovascular function, cardiorespiratory function. So I think a combination of things are probably helpful there.
Yeah. I see nodding heads over here to the right. So thoughts on HIIT and strength training?
Well, and I think we all have different things that we prefer to do too. And part of that is motivation. What will keep you going? Do things that you like to do. But I think you have to do a basis. If you only walk, you're probably not going to build your strength the way you want to do as you age, but walking's still great. So it's not one or the other. It's trying to find that happy mix that works for you. But you do need to do some form of progressive resistance training, and getting in and out of your chair is a form of progressive resistance training that you can do. So you need to combine, but I agree with Matt, you can't just do that and then not do aerobics. It's finding that sweet spot that Laurie talked about for you to work in, and what's the recipe that works for you that you can keep doing, because that's the other big thing, is you can't stop. So what do you enjoy doing that will motivate you to keep doing it and keep you moving?
Hiemstra, Gabel? Yeah, it seems like sustainable. What is sustainable is a theme that I'm hearing come up quite a bit. One of the top most voted questions here is, what do you recommend for bone health supplements? Choices of the best blends of vitamins. I hear laughing, but I think I'll let it go down the line if you want to address that.
Yeah, I'm not a registered dietitian. Neither are any of my colleagues up here. If I could put on my hat of what I would hope my colleague Raylene Reimer would say, and she is a registered dietitian, she'd first talk about how what you eat is important, and you can largely get everything you need for your bone health from your diet, save for vitamin D, which we cannot make here in Calgary naturally at least 6 months of the year. So a vitamin D supplement is something that is important for bone health and probably should be added. And anything else on top of that, you really can get through diet. Through Raylene's hat, she would also want me to outline that probably very few of us are getting enough fiber in our diet. That's really important for gut health and a lot of other things, as is protein, particularly as we age. If you're not sure how much protein that you are getting, there's a few really easy calculators to use online. I think Osteoporosis Canada has sort of like a food diary that you can track what you've eaten for a day or so, and it will let you know how much protein you're getting. We need protein to be able to build new muscle. So if you are not taking in enough energy, and particularly enough protein in general, then you're not going to be able to replace the muscle that is being lost or being broken down. And the recommended amount for that right now is 0.8 grams per kilogram body weight or body mass. That's probably the absolute minimum. So a lot of folks are sort of recommending you get closer to 1.0 or 1.2 grams per kilogram body mass. It doesn't have to be meat. It can be legumes. There are a lot of different ways to get protein, but I think that would be my 2 cents is actually for bone health. Most of it you can get through your diet if you're intentional.
Yeah.
I'll just piggyback just a couple of little tidbits is that there's some evidence that's come out recently that's showing that as we age, our body's ability to use protein starts to go down a little bit, which builds off of what Leigh said, that maybe as we get older, you could see almost as though the body's just not taking it in and assimilating it like it used to, which might be, to further the point, a good reason to ensure that your diet has got sufficient protein. Certainly, the vitamin D is very much low-hanging fruit for lots of Canadians, just because of where we live. The calcium and dairy side of it is also an important piece to think about, which complements as well with the protein side. I think the nutrition is just none of us are nutritionists, so we have to sort of steer our lane, but I really think the nutrition is so complementary for how exercise helps your body, whether it's inflammation or building muscle and bone. There's a lot to be gained by putting those two together. They are very, very synergistic. Can I say one more thing, and then I'll stop droning on?
Keep going.
There was a couple studies that I use in my class when I'm teaching students. Is that the science has sort of pointed to that maybe by the time you hit your 90s, that there's an impairment in the ability to build muscle. So you can still get strength can go up and power can go up because your brain's learning how to use your tissue better. But the idea that maybe the muscles just can't respond the same way. And this study that we sometimes looked at, was, the mean age of the participants was 94. 94. And they had these participants doing 1 RM testing at the start of training, progressive resistance training down to 5 repetitions, which is similar to what Leigh's study was doing. And they had them supplementing with protein. And it was very interesting to note that in that group, they were able to increase the size of their muscles, even in their 90s. Wow. So it's an interesting angle about how nutrition and exercise are really symbiotic.
How much do the two of you include any sort of nutrition advice or work alongside those guidance when you're working with clients? Because there's a lot of questions coming in on how important is my diet alongside recovery, rehab, and strength training.
Yeah, so we have a nutritionist that works at our clinic, so it's very important to us. I'm going to put another plug in for vitamin D, because we always talk about calcium and vitamin D for bone health. But vitamin D is very important for other parts of your body as well. So there's a huge study came out of Scandinavia that patients who tear their ACL have low levels of vitamin D. So I think it's not just your bones. So if you're sitting there going, hoo, I'm from, Middle Europe and I have really great bones, it's not just your bones, but it's other. So we think it's a huge part of recovery from injury and surgery, and we encourage our patients to see a nutritionist and maximize those things. So your body has all the building blocks to heal.
We'll move on to another exercise-related question, top voted one. Is there any research, and I'm going to toss this out to the 4 of you, on the impacts of deep water exercise on bone mineral density?
I don't know.
So I've never done deep water exercise myself, so I can't speak from lived experience. I could talk about, I guess we can talk about swimming in general. Great form of exercise, fantastic for your cardiovascular system, great for your mobility. But we know that swimmers tend to have lower bone mineral density than any other athletes because it's not a weight-bearing sport. So I can't imagine how deep water activities might improve your bone density. So my caveat would be, if you love it, do it. Any exercise is good, particularly for other aspects of your health, but having some weight bearing and strength building work on land is also going to be important.
Yeah, bone responds to impact and weight. So it's hard to imagine that, like water exercise, lots of benefits to it, but to build bone health, we mostly rely on impact. Like we need people to be weight bearing and, through arms, legs, putting some stress on the bone.
Okay, so this one works perfectly then, because it was the next question. Does walking with a weighted vest, another thing that's marketed at us quite a bit, help with bone density? Maybe not building more density, but possibly with help not losing any more density.
I'm laughing because I know it's all over social media. There's been some pretty prominent folks on social media promoting it. If you don't currently have one, do not waste your money buying one for your bones. The nuance is, if you haven't been exercising, if you weren't exercising previously, and now that you've got this weighted vest, it's getting you out and it's getting you moving, that's great. We have zero evidence that it does anything to improve our bones or even maintain bone health. So I will say those are largely overplayed in the media. No good science around it.
Do we agree?
Yeah, no, I think the only place I've seen it with rehab is a way for people who have balance. Often we're doing training for exercises. We'll put the weighted vest on instead of having them hold weights because it frees up their hand. But, so don't buy it. It's not like it's just another tool that we would use for frail women or men to help them do their exercises. But it's not worth the expense, quite frankly.
Yeah, I mean, I'll just maybe add one more thought on this, and I'm taking my science hat off, and I'm just going to put my exercise hat on. I think one thing that many of us find challenging as we age is that activities that are outdoors, like running. You used to love to run when you were in your 20s, and then all of a sudden it's like, you know what? I'm not sure if that is worth the cost. I think the idea of using a weight vest to sort of intensify a walk so it becomes more, you get to go outdoors and exercise, and you can use a walking modality. That might be where I think a weighted vest can be helpful. Takes a normal walk and makes it a little bit more rigorous.
But if you have osteoarthritis, I'll tell you, you probably don't want the extra weight because it's just putting more weight on so it very much is you have to balance. Because, with osteoarthritis, we are telling you that when you can reduce weight through the joints, that can make it feel better. So you're always, when you're working with strength, trying to find that happy medium that you can do to try and build strength, but not overweight. So wearing like a weighted vest is kind of like gaining 5 pounds, which might make your sore joints, make you able to exercise for shorter periods because it makes your joints sore. So,
yeah, amplified pressure on your joints when maybe you don't need it. We've got about 2 minutes left, and a lot of these are exercise-related questions. This one may be simple, but feel free to expand on it if you have more to say about strength training. Many people curious about, Pilates and swimming, and do I have to add in strength training alongside all of these things? So the basic way and the top voted question is, how often should strength training be done a week when also doing cardio? Thoughts to the panel?
We would say a minimum of 2, right?
Yeah.
I mean, I sort of say when people really, really hate exercise, okay, 1 might maintain, but, more is better. But minimum of 2 strength training is kind of, resistance training is what I would add. I don't know, Matt, maybe you.
Yeah, I was going to say 2 to 3 days per week on non-consecutive days.
Yeah.
Do you want to add a little bit more?
If I was to add a little bit more, so 2 to 3 days per week on non-consecutive days for the same muscles. So that's actually one thing that becomes kind of fun with resistance training. So once you get involved with it, a lot of people find it engaging. And so you could, let's say, do your lower body muscles on one day and your upper body muscles on another, right? So we always sort of think about it as non-consecutive days for the same muscle groups. Would be the important thing. But 2 to 3 days a week, that's where lots of the benefits get conferred. Were you going to add some more, Leigh?
Yeah, I was just going to say, Canada has really wonderful 24-hour movement guidelines. They don't look as flashy as what you might see on Instagram, but they're backed by really good evidence. And although there hasn't been a lot of research that has included women, particularly through the menopause transition, I don't see those recommendations changing. They recommend 150 minutes per week of moderate to vigorous physical activity, so that's anything a brisk walk and above. And then they recommend strength training 1 to 2 days per week, strength building activities. I think that the tricky part is in sometimes knowing what are those strength building activities, what are they going to look like. I will mention that it's how do I fit all of this in? I like to use the word rhythm instead of balance. Wintertime, I probably strength train more because I'm not outside as much. When it's nicer weather, I'd prefer to be outside getting more cardiovascular activity. So it doesn't necessarily have to be this rigid balance throughout the year. It can be a rhythm, thinking about how you're getting it in. And I guess one of the phrases we like to say is, cardiovascular exercise, that is going to add life to your years, but it's the strength building activity that will add, other way around. Cardiovascular exercise adds years to your life. It's really important. We know folks live longer if they're more active, but it's the strength building exercise that adds the life to your years. So they very much complement one another in that sense.
It's great to see, and it sounds like we're very much on the same page. I do have to wrap things up, but I'd like to give people, one last moment for a quick takeaway. If you had to sum it up and you want people to walk away with something today, we'll start with Dr. Beaupre and then work our way down. I know, I'm putting you on the spot, but something you're passionate about or a takeaway for today.
I sit less, do more. Seriously, we are very sedentary as we age. Move, find something that you enjoy and do it, and sit less and do more.
Yeah, find something you like. You're not going to go to the gym if you hate the gym. I hate swimming, I'm not going to swim. So keep moving, vary it, but find things you like to do, because then it's not hard to keep doing them.
Well, I hope the main message was that it's never too late to start. But I think maybe I'll give you one more, hopefully, bit of encouragement that small amounts actually have a big impact. And sometimes when you think about getting back to the gym, you're like, oh my gosh, I've got 2-hour workouts Monday, Wednesday, Friday, and all this stuff I need to do. Have your trainer boil it down to, sometimes we call it a plan B, which is like, what does 25% of that big workout look like? And remember that 25% is actually really effective. So small amounts go a really, really long way with exercise.
Yeah, I love all of that, especially it's never too late to start. And I guess I'd say for anybody unsure where to start, and particularly I'm thinking of a lot of the women in the room, we thrive on social connections. Find a friend, find someone who is also interested in doing this. The women in our study, they came, the attendance was fantastic. It wasn't because they necessarily loved the exercise, like it was hard work. They really enjoyed each other's company. So that social connection is huge, and if you can do something called habit stacking, so making your movement also a social activity, I think that's something that will help you keep it going forward in the long term.
Wonderful. Well, thank you so much to our panelists. A big thank you to our speakers for sharing their research. I will let you gracefully exit so you don't have to hang out with me while I wrap things off, but thank you so much for all your time, your research, your takeaways, many that I'll take home. Never too late to start, sit less, do more. It's all great. Also chunking things into manageable equations. And the social equation, definitely. I like to say my girlfriends and I live in the pain cave, but not actually pain. We just enjoy doing the workouts together. Okay, so if you would like to see more content like this, please stay in touch with the McKaigue Institute on social media. They are on X, Facebook, YouTube, Instagram, and LinkedIn. Thank you again for coming today. So we are already thinking about 2026. Mark your calendars, Saturday, November 7th, 2026. If you have yet to vote, please open our poll. It's in that Slido app where you were all putting in those fantastic questions. Have your say on next year's topic. You can also complete a survey, which will be sent out next week, so keep your eyes posted for that. And finally, and of course, sign up for the McKaigue Institute newsletter so you can know about this Wood Forum first and all other events. Now, here's a fun part too. As we come to the end of our program, we have one last task, which is to draw for our coveted door prizes. She saw me looking for the door prizes here. I've got my handy-dandy organizer helping me out here. So you must be present to win, remember, so don't run away on me, walk away on me, whatever it needs to be. We kindly ask the winners to make their way to the door prize table in the back to claim your prize at the end of the program. So I've got Stephanie over to the left to help me up. Help me up. I've been listening too much about getting in and out of chairs. To help me out and draw these door prizes. Really glad I sold my weighted vest last week on Facebook Marketplace. If you're in there, I'm sorry, but it was a great deal. All right, so we are starting off with the Italian Center Shop, yeah? Okay, I thought it was the Foxtrot. Let's do Foxtrot. We're gonna start off with a $250 gift card, I believe, to the Foxtrot restaurant at Spruce Meadows. If you have not been, gorgeous new space, just opened down at Spruce Meadows. Best view in town, personally, I would say. And this one is for raffle ticket number 0178874. Yay, hopefully you got it. Hopefully someone's in the room to come to the back. Yes, there we go. Yeah, wave your hand at me so I know you're in here. I love it. Congratulations. You guys are so nice. Clap for the winners, yes. All right, next door prize up for grabs is a Mercado gift basket. So I'm really making you work, Stephanie. I'm making you work. Everyone's good. Mercado gift basket. Stephanie's pulling the number. Watch your tickets. 0178917. Got you in the room. That's you. Congratulations, front table. Looked astonished. I love it. Just pick one of them. All right. Next one we have is an international Christmas market experience at Spruce Meadows. I go every year. It's so much fun, and it's huge. So make sure you give yourself the whole day to actually walk through everything. And the winner of that one is 0178962. Yay, okay, I see you in the middle there. Congratulations. Next up, we have a relaxation and wellness package, and I believe that is Well, it's a relaxation and wellness package. We all want that right now. It's 2025. Come on through. 0178956. Remember, you have to be present to win, so just go to the back to claim your prize. Next up, we have an Italian Center shop. I love, love, love the Italian Center shop. All right. 0178608. 0178608. Perfect. Back there, you have won a gift basket to the Italian, or rather, I believe it's a gift basket to the Italian Center shop. Okay, so that is all we have for the draw prizes. Remember to go to the back and claim them. Thank you so much to the local businesses that did donate these prizes to the event today. That does include our event today. Thank you to the over 30 volunteers that gave their time. A big thank you to Dr. Donna Wood, as well, her family. Yes. A great reminder of why we are all here today, and the Wood Joint Research Fund for enabling us to continue. Thank you to the Alumni Partnership Fund for supporting. And of course, one last round of applause as we exit for all our speakers today. Thank you, and move well.